Thank you for visiting Dean Health Plan's online seminar. This on-demand session was created so viewers like you could watch and reference at any time in the convenience of your own home. Feel free to pause this video if need be to take notes at your leisure. In this video, we are going to cover the 4 parts of Medicare, how Medicare Advantage and Part D works, Medicare Advantage enrollment periods and who is eligible to enroll, as well as a brief introduction to the 5 Dean Advantage plans: the Essential HMO, Assurance HMO, Balance HMO, Confidence HMO POS, and Complete HMO, including the provider network, benefits, prescription drug coverage, and how to enroll. Let's start by understanding the A, B, C's, and D's of Medicare. Medicare Part A is hospital insurance and helps pay for hospital stays, skilled nursing care, and home health care. Part B is medical insurance that helps cover doctor's visits and outpatient care. The Part B Medicare standard premium is set by CMS on an annual basis and paid by most original Medicare beneficiaries. Part A and Part B are also referred to as Original Medicare or Traditional Medicare. Part C is a Medicare Advantage plan that combines Original Medicare and usually includes Part D. Medicare Part D, otherwise known as prescription drug coverage, helps pay for outpatient prescription drugs. It's important to understand some basic insurance terminology. Premium, that's the amount you pay for insurance coverage. Deductible, an amount you pay before any coverage levels start. Copay, a flat dollar amount that is your responsibility for a health service like a doctor visit or prescription. Coinsurance, a percentage you pay towards a health service like lab tests. Cost sharing, a general term used to define any amount you pay out of pocket with insurance. And maximum out of pocket, an overall maximum you pay for all cost sharing combined in any category or situation. Now let's get into how Medicare Advantage works. Medicare Advantage plans are provided by a private insurance company such as Dean Health Plan. The insurance carrier contracts with Centers for Medicare and Medicaid Services, otherwise known as CMS. A Medicare Advantage plan replaces Original Medicare, providing you with all your Medicare Part A, Part B services, and Part D benefits all wrapped into one plan. Note that some Medicare Advantage plans do not have Part D coverage. A Medicare Advantage plan provides a maximum out-of-pocket cost for its members and may add additional benefits above and beyond. There are essentially 4 phases for Part D. We will try to break it down so it's better for you to understand. Stage 1 is the deductible stage. You will pay 100% of the cost of the drug until the deductible is met. Stage 2 is the drug cost share or copay stage. In this stage, you will pay copays for each prescription and the plan pays the rest until the initial coverage limit is met. Stage 2 ends when you and the plan have together paid $3,820. Stage 3 is the coverage gap stage, also known as the donut hole. In this stage, you pay 25% on brand name drugs and 37% on generic drugs. Stage 3 ends when your total out-of-pocket costs reach $5,100. Stage 4 is the catastrophic coverage phase. In this stage, you will pay as little as 5% for the rest of the year. For brand name drugs, you will pay $8.50 or 5%, whichever is greater, and $3.40 or 5%, whichever is greater on generic drugs. The stages start over each year on January 1st. The insurance company will send out an explanation of benefits on the prescription side to give you a heads up on where you are in each stage. What is a formulary or prescription formulary? A formulary is a list of medications that are covered under a Part D plan or a Medicare Advantage Part D MAPD plan. The formulary shows which medications are covered and under what tier of coverage. The tier tells you what type of coinsurance or copayment will apply to the medication for a particular plan. Here's an example. Company A, non-preferred generic medication is a Tier 2. The copay is $14. In Company B, non-preferred generic medications in Tier 2, the copay is $10. Let's take a look at the timeline for enrollment into a Medicare Advantage plan. Here we have a calendar ranging from October to January. There are some key dates that you need to be ready for. Let's first talk about pre-enrollment. Pre-enrollment occurs October 1st, 2018 through October 14th, 2018. During this time, you can compare plans so you are ready to enroll by October 15th. Be sure to wait until October 15th to submit your application. Next, we have the annual enrollment period, otherwise known as AEP. This runs October 15th, 2018 through December 7th, 2018. This is the time that you can enroll in plans or make changes to current Medicare benefits. Lastly, we have the open enrollment period, also known as OEP. This occurs January 1st, 2019 through March 31st, 2019. During this time, you may switch from a Medicare Advantage plan to another Medicare Advantage plan or terminate your Medicare Advantage plan and return to original Medicare. To enroll in Dean Health Plan's Medicare Advantage, you must have Medicare Parts A and B and continue to pay your Part B premium. You also must be a permanent resident of our Dean Advantage service area, which includes Columbia, Dane, Dodge, Fond du Lac, Greene, Iowa, Jefferson, Rock, and Sauk counties. And you can only be out of the servicing area for 6 months or less. Individuals with end-stage renal disease are not eligible to enroll in a Dean Advantage plan except under certain conditions according to federal law. For details, please contact a Dean Health representative or visit Medicare.gov. Dean Health Plan is very competitive when it comes to having a strong network of care. We have over 700 primary care providers, over 50 skilled nursing facilities, and over 1,500 specialists, 19 hospitals, and much, much more. If you are unsure whether your provider is in our network, visit deancare.com/findadoctor or call Member Services at 1-877-234-0126 TTY 711, 8 a.m. to 8 p.m. weekdays year-round, and weekends October 1st through March 31st. Dean has an extensive pharmacy network that includes most major chains such as Walgreens, Walmart, Hy-Vee, and Shopko, to name a few. We also have a mail-order pharmacy through Costco RX, where you can save time and money by getting a 90-day supply for only 2 copays on Tier 1 and Tier 2 drugs. This option also includes free shipping. You have choices when it comes to your health insurance coverage. Here's a look at the different plans that we offer under Dean Advantage. New for 2019, we expanded our network into Greene and Fond du Lac counties. We are excited to partner with Agnesian Healthcare. We also added a travel benefit on the Complete plan. It is important to note that an HMO plan is subject to a network, meaning you must use plan providers in order for services to be covered. An HMO POS plan has an in and out of network benefits, so you have the freedom to see any doctor that you would like to see, but you will have better benefits using in-network providers. Being on a Dean Medicare Advantage plan has a lot of benefits, including no waiting period for pre-existing conditions. Whether you have had cancer or a major surgery in the past, we will not hold that against you. Competitive rates that do not increase due to age. Our plans are not age-banded, meaning if you are 65 or 90, the premium is the same. No formal referral needed as long as you see a plan provider. Added benefits such as preventive dental coverage and covered gym memberships, preventive services like your annual wellness visits, mammograms, colonoscopies, and some vaccines including the flu and pneumonia shot. When making a selection, it's always a good idea to consider that the plans are cost-effective for you, that your drugs are listed on the formulary, and your primary care doctor, specialist, and hospitals are available in our network before making a decision. This is an overview of the supplemental benefits that Medicare doesn't cover that Dean Advantage plans cover as added benefits. In order to get these services covered, they must be performed by a plan provider. We will discuss these in more detail shortly. Now let's take a closer look at each of our Medicare Advantage plans' coverage and added benefits. Some key features of the Essential Plan are $0 monthly premium, $20 copay for primary care office visits, $50 copay for specialist office visits, $50 copay for urgent care, $80 copay for emergency room, $300 copay for outpatient surgery, $400 copay per day for days 1 through 4 for inpatient hospital care. Days 5 through 90 would be covered at 100% per benefit period. $6,700 maximum out-of-pocket. Some enhanced benefits of the Essential Plan include $500 copay up to an annual maximum of $50,000 for worldwide emergency and urgent coverage. Please note, this is only for emergency and urgent care coverage while outside of the U.S. Earn up to $25 in healthy rewards. Gym membership is covered yearly when using a Network Silver and Fit gym. Some network gyms include Anytime Fitness, Prairie Athletic Club, Planet Fitness, and Curves. Please be aware that not all these gym locations may be in network. $20 copay for acupuncture services, up to 12 routine visits yearly. Preventive dental, including 1 cleaning and 1 exam yearly with no cost to you. $20 copay for chiropractic services, up to 12 routine visits yearly. Please refer to the How Part D Works section of this video if needed. On the Essential Plan, you will have a $415 RX deductible. For tiers 2 through 5, you are responsible for paying this deductible prior to reaching your copay stage. Tier 1 is not subject to the deductible, which means you will start in the copay stage immediately. Tier 1 has a copay of $9. Tier 2 has a copay of $20. Tier 3 has a $47 copay. Tier 4 has $100 copay. And Tier 5 has a 25% coinsurance. The initial coverage limit is until you and Dean have together paid $3,820. Coverage gap is from $3,821 through $5,100. Once you reach the catastrophic coverage, you pay as little as 5%. Some key features of the Assurance Plan are $40 monthly premium, $15 copay for primary care office visits, $40 copay for specialist office visits, $40 copay for urgent care, $80 copay for emergency room, $250 copay for outpatient surgery, $325 copay per day for days 1 through 4 for inpatient hospital care. Days 5 through 90 would be covered at 100% per benefit period. $6,000 maximum out-of-pocket. Some enhanced benefits of the Assurance Plan include $500 copay up to an annual maximum of $50,000 for worldwide emergent and urgent coverage. Earn up to $50 in healthy rewards. Gym membership is covered yearly when using a Network Silver and Fit gym. $20 copay for acupuncture services, up to 12 routine visits yearly. Preventive dental includes 2 cleanings and 2 exams yearly at no cost to you, a $75 eyeglass allowance yearly, and $15 copay up to 12 routine visits annually for chiropractic services. On the Assurance Plan, you will have a $350 RX deductible. For tiers 3 through 5, you are responsible for paying this deductible prior to reaching the copay stage. Tiers 1 and 2 are not subject to the deductible, which means you will start in the copay stage immediately. Tier 1 has a $6 copay. Tier 2 has a $14 copay. Tier 3 has a $47 copay. Tier 4 has a $100 copay. Tier 5 has a 26% coinsurance. The initial coverage limit is until you and Dean have together paid $3,820. The coverage gap is from $3,821 through $5,100. Once you reach the catastrophic coverage, you pay as little as 5%. Some key features of the Balance Plan are an $82 monthly premium, $10 copay for primary care office visits, $40 copay for specialist office visits, $40 copay for urgent care, $80 copay for emergency room, $200 copay for outpatient surgery, $250 copay per day for days 1 through 4 for inpatient hospital care. Days 5 through 90 would be covered at 100% per benefit period. $4,000 maximum out-of-pocket. Some enhanced benefits of the Balance Plan include $80 copay up to an annual maximum of $50,000 for worldwide emergent and urgent coverage. Earn up to $100 in healthy rewards. Gym membership is covered yearly when using a network Silver and Fit gym. $20 copay up to 12 routine visits annually for acupuncture services. Preventive dental includes 2 cleanings and 2 exams and 1 x-ray yearly at no cost to you. $125 eyeglass yearly allowance. $300 hearing aid allowance every 3 years. $10 copay up to 24 routine visits yearly for chiropractic services. On the Balance Plan, you have a $200 RX deductible. For Tiers 3 through 5, you are responsible for paying this deductible prior to reaching the copay stage. Tiers 1 and 2 are not subject to the deductible, which means you will start in the copay stage immediately. Tier 1 has a $3 copay. Tier 2 has a $10 copay. Tier 3 has a $47 copay. Tier 4 has a $100 copay. Tier 5 has a 29% coinsurance. The initial coverage limit is until you and Dean have together paid $3,820. The coverage gap is from $3,821 through $5,100. Once you reach the catastrophic coverage, you may pay as little as 5%. The Confidence Plan has a $185 monthly premium. Some key features of the Confidence in-network plan are $0 copay for primary care office visits, $20 copay for specialist office visits, $20 copay for urgent care, $80 copay for emergency room, 10% coinsurance for outpatient surgery, $150 copay per day for days 1 through 4 for inpatient hospital care. Days 5 through 90 would be covered at 100% per benefit period, and a $2,000 maximum out-of-pocket. Some key features of the Confidence out-of-network plan are $30 copay for primary care office visit, $60 copay for specialist office visit, $20 copay for urgent care, $80 copay for emergency room, 20% coinsurance for outpatient surgery, $500 copay per day for days 1 through 3 for inpatient hospital care. Days 4 through 90 would be covered at 100% per benefit period, and a $10,000 maximum out-of-pocket. Some enhanced benefits of the Confidence Plan: you earn up to $150 in healthy rewards. In-network plan details include gym membership is covered yearly when using a network Silver and Fit gym, $10 copay up to 24 routine visits yearly for acupuncture services. Preventive dental includes 2 cleanings, 2 exams, and 1 x-ray yearly at no cost to you. Comprehensive dental includes restorative services and fillings only with a 20% coinsurance. $250 eyeglass allowance yearly, $500 hearing aid allowance every 3 years, $10 copay up to 24 routine visits annually for chiropractic services. Some enhanced benefits of the Confidence out-of-network plan include $80 copay up to an annual maximum of $50,000 for worldwide emergent and urgent coverage, and a $30 copay up to 24 routine visits annually for chiropractic services. On the Confidence Plan, you have no RX deductible. You immediately will go into the copay stage. Tier 1 has a $3 copay. Tier 2 has an $8 copay. Tier 3 has a $47 copay. Tier 4 has a $100 copay. Tier 5 has a 33% coinsurance. The initial coverage limit is until you and Dean have together paid $3,820. The coverage gap is from $3,821 through $5,100. Once you reach the catastrophic coverage, you pay as little as 5%. Some key features of the complete plan are a $226 monthly premium, $0 copay for primary care office visit, a $0 copay for specialist office visit, a $0 copay for urgent care, a $50 copay for emergency room, a $0 copay for outpatient surgery, a $0 copay for up to 90 days for inpatient care, and a $400 maximum out-of-pocket. Some enhanced benefits of the complete plan include $0 copay up to an annual maximum of $75,000 for worldwide emergency and urgent coverage. Travel benefit covers people for services as in-network anywhere in the U.S. except for in Wisconsin and is available for periods up to 90 days for a maximum of 6 months per year. Earn up to $200 in healthy rewards. Gym membership is covered yearly when using a network Silver and Fit gym. $10 copay for 24 routine visits yearly for acupuncture services. Preventive dental includes 2 cleanings, 2 exams, and 1 x-ray yearly at no cost to you. For restorative and comprehensive dental services, the plan pays 50 to 80%. The maximum for all dental benefits is $1,500 per year. Note, this does not go towards your $400 medical maximum out-of-pocket. $250 eyeglass allowance each year, $800 hearing aid allowance every 3 years, and $0 copay up to 24 routine visits yearly for chiropractic services. On the complete plan, you will have no RX deductible, so you will start out immediately in the copay stage. Tier 1 has a $3 copay, Tier 2 has an $8 copay, Tier 3 has a $45 copay, Tier 4 has a $100 copay, Tier 5 has a 33% coinsurance. The initial coverage limit is until you and Dean have together paid $3,820. The coverage gap is from $3,821 through $5,100. And once you reach the catastrophic coverage, you pay as little as 5%. Dean Advantage plans provide both your Part A and Part B benefits, as well as your Part D benefits. Only one plan to manage and fewer payments to track. We eliminate your Medicare deductibles and coinsurance. You pay an affordable copay on most services. There is a maximum out-of-pocket limit that protects you from large catastrophic healthcare expenses. This is the most that you will have to pay for in a year for Medicare medical covered services. Prescription drugs are covered on all our plans with manageable copays according to our formulary. You receive dental coverage on all our plans from preventive to comprehensive care, depending on the plan you choose. You will also receive 100% covered basic gym memberships through in-network health clubs. Dean Health Plan is part of an integrated health system where the insurance company and the hospitals and the clinics work closely to build a better patient relationship. Before making a final decision on what best fits your needs, you should make sure your medications are covered under our plan. Our prescription drug formulary is available online at deancare.com/Medicare. You can also call our member services for help in looking up your medications. The member services number is 1-877-232-7566. You can enroll in one of Dean's Medicare Advantage plans anytime between October 15th and December 7th for coverage starting on January 1st. These are 4 easy options to enroll. Online by visiting deancare.com/Medicare, in person by scheduling an appointment, over the phone with a Dean Medicare agent, or by calling to request a free Medicare enrollment kit to fill out a paper application and return by mail. Dean has a dedicated local sales support team to help you. Please contact us toll-free at 1-877-234-0126, TTY 711 with any questions. Walk-ins are available by appointment only, Monday through Friday, 8 a.m. to 4 p.m. at 1277 Deming Way, Madison, Wisconsin, 53717. That will conclude our online seminar. Now's the time to understand what plan is right for you. We can help you understand what your out-of-pocket costs would be under the different Dean Medicare Advantage plans to find the best value and price for you. Make the most of your Medicare dollars and choose a plan that makes sense.